Hello, everyone. I'm Judith Perez, Granado. I'm VA Director at LARVOL, and today I'm happy to be here presenting our latest publication at ASCO called Systematic Review of BCMA-targeted therapies in relapsed refractory multiple myeloma. This abstract was published in collaboration with Dr. Kamal Saini at Fortrea and Addenbrooke's Hospital in Cambridge, UK, as well as some other team members from Fortrea and the Department of Radiation Oncology in India. So to get started onto what this abstract and this publication was about, we focused on multiple myeloma patients, especially under the setting of relapsed refractory, since there's still unmet medical needs. And thanks to recent breakthroughs in BCMA-targeted therapies, we have led to these new treatment options, especially under CAR-T and ADCs. So in this abstract, what we do is explore these emerging and these new strategies that would reshape this multiple myeloma treatment. In order to do that, we went to a LARVOL Clean database, which is an oncology outcomes database that integrates published data from oncology clinical trials using natural language processing, machine learning algorithms, and manual expert curation. And in there, we have a database of over 100K clinical trials, 95K Kaplan-Meier curves, and 95K hazard ratios. And in this database, we conducted a comprehensive research to identify phase 3 trials that were evaluating the BCMA targeting agents in this relapsed refractory multiple myeloma. Then, once we identified these trials, what we did was to conduct a meta-analysis using this digitized KM data and hazard ratios. If we go to the results, we built this type of table landscape with the 5 trials that had mature data on BCMA targeting therapies for multiple myeloma. The first 2 trials are KarMMa-3 and CARTITUDE-4, which use CAR-T cell therapy. The intervention for KarMMa-3 would be ide-cel and CARTITUDE cilta-cel. Indeed, CARTITUDE-4, we can see that it met its primary endpoint, seeing that the PFS was significant, while we have, in another hand, the DREAMM-3, DREAMM-7, and DREAMM-8 trials, which focus on ADC, either in monotherapy or in combination therapy. Indeed, let me jump to our database and our Clean platform so we can better see more interactively these results. So as I was saying, DREAMM-3, DREAMM-7, and DREAMM-8 focus on this ADC. We can see that DREAMM-7 is in monotherapy. Belantamab did fail to meet its primary endpoint, while we can see DREAMM-7 and DREAMM-8 evaluate this ADC, belantamab mafodotin, in combination with either bortezomib and dexamethasone or pomalidomide and dexamethasone. In this case, DREAMM-8, by the time we constructed this landscape for the ASCO publication, it was in recruiting phases. Now it's active, not recruiting, yet not completed. And by the results we can see in here, DREAMM-7 and DREAMM-8 have met its primary endpoint, that it's PFS. And DREAMM-7 indeed also has shown significant results under OS. The overall response rates across all these different trials, we can see that it's higher per the intervention arm compared to the different standard regimens. So like both in these CAR-T trials, 72.3 and 84.7, compared to the others, as well as this DREAMM-7 and DREAMM-8. Yes, if we go also, I wanted to point out something on AEs. Under AEs grade 3+, we can see also some differences under the safety profiles, because despite the effectiveness, BCMA-targeted therapies have distinct profiles as per CAR-Ts. We have seen that they have been associated with immune-related toxicities and cytokine release syndromes, while the ADCs are more associated with ocular toxicity. Going back to Clean platform, I wanted to share as well how these outcomes results do look under the KM plot. So if we're to check the KM curves in our platform, if you go under the PFS in here, which is the primary endpoint, We have digitized all KM curves with the results associated to these trials, as we keep track of all the publications that do have data releases. And in these digitized KM curves, if we collapse in here, we can check out which are the curves that are being displayed in this KM plot. As you can see, the solid line would constitute the intervention arm, and the dotted line, the different control arms. And we have different trials with the different curves displayed as different colors, right? We can see a clear distinction on top with CARTITUDE-4, which has indeed led to the approval of its CAR-T in second-line plus. We have this DREAM7, which is pointing towards significant PFS data, and DREAM8 as well, while at the bottom we can see these dotted lines that constitute the control arms. So showing these differences in effectiveness, as well as we can see also this DREAMS3 that we know that it failed its primary endpoint, and we can see that it's placed as well with the control curves of other trials. And if we were to check it out under the forest plot, so evaluating the hazard ratio between this intervention to comparator arms, we can see that in there, the DREAM3 is the one that failed to meet its primary endpoint. So in this case, the Blenrep, the ADC in monotherapy, would not be a good regimen compared to standard ones, but DREAM8, DREAM7 that do evaluate this ADC in combination therapies do show good results in contrast to standard regimens, and CARTITUDE-4, which we know that has been approved. We can see also a hazard ratio below 1 and with significance. Indeed, if I were to evaluate also, we are showing in here the timelines, which is very interesting since we can see that in KarMMa-3, we know that it has been already approved, the ide-cel treatment, and we can track it back in here with all the milestones, and we have seen the filing dates as well as the approval dates. Then we had this KarMMa-3, which failed to meet the primary endpoint, as we have seen. So in here, recommendation for non-renewal. And then if we move to the CARTITUDE-4, which again is an approval in second-line plus, we can see the data releases and the FDA approvals in here. And the upcoming ones that are bringing these innovative therapies, right, to the probably reshaping this multiple myeloma treatment are the DREAM3 and DREAM7, which right now, if they have been, there's been an approval in here, there have been the filings, the PDUFA date that it's coming soon under the July 23rd. And under DREAM8, we can see as well some filings, estimated milestones in here, and the approvals that have happened. Finally, I wanted to walk you through our tutor reactions tab. So in here, we are tracking all comments that are associated to the data releases and these trials in specific in this case in X. So we do some sentiment analysis around those posts where, and this is AI powered, where we identified whether a tweet, it has a negative rated sentiment, mixed sentiments, positive, or it's even associated with some practice informing or practice changing, right? In this case, we can see some not rated results, but what's more interesting is those that are positive on CARTITUDE-4. We can see there are a bunch of positive X posts where we can, if we click on the column, we can jump directly to the post of the different over 6,000 DOLs, digital opinion leaders, that we could keep track. And all these positive comments. If we were also to go into the other side of the coin, under DREAM7, we see also some negative results, or some negative comments, sorry, where we can see indeed that they are calling out this toxicity that we have mentioned, that the toxicity profile is showing some adverse events, but yet this balance between risk favorability, it's right now leaning towards better results under this ADC. Design issue here, they're calling out because indeed for the negative sentiment, we might be able even to trace back the reason why this negative sentiment has been pointed out. In this case, it's such toxicity again. And let's go back. Let's see also some negative sentiments under DREAM3, which it has been pointed out as failed in meeting primary endpoint. DREAM8, as we were seeing, we even have some sentiments under practice informing and practice changing. So people, it's being positive about the results that are being published in there. And this is from this April. So let's wait for the final results. So despite having these reported adverse events, we have seen that there's some favorable risk safety profile compared to standard regimens, which might lead us to this reshaping of the multiple myeloma space. Thank you very much.